Thank you, Mr. Chair. The allegation that NIH-funded research in China led to the release of COVID-19 from a lab has been routinely debunked. I ask unanimous consent to submit a document for the record published by NIH demonstrating that SARS-CoV-2 and the types of viruses studied with NIH funding are too genetically distant to be directly related. We all share interest in biosecurity, but we should make decisions, obviously, based on facts.
Happy to recognize or to admit that without objection. Would just note that with a huge hole in the data, how do we know? Without objection, so ordered.
Thank you, Mr. Chair. As scientists learned more about the virus that causes COVID-19 and the best approaches to keeping us all safe, it was important that decisions made about public health guidance and investments evolved alongside it. This means that information and guidance were revised to keep up with our growing understanding of the virus. And despite criticisms of those changes, it is in the best interest of the nation to ensure that the public is armed with the best information that we have at the time. So, Dr. Califf, as we've discussed, vaccination is our best shot at keeping the American public safe and healthy. Observing how the virus itself changed over time led to the development of new vaccines, like the bivalent booster, to target new variants of SARS-CoV-2. Why is it important for FDA's regulation of biologics and vaccines to be responsive to emerging science about SARS-CoV-2?
Well, I think the emergence of these new variants is proof of principle right there. And if we didn't have all the research going on to look at the variants, to produce them in laboratories, to test whether it's therapeutic antibodies or vaccines, we couldn't keep up, and we would lose the effectiveness of our vaccinations over time. So just like with flu vaccines that are updated every year, we're going to need to update our COVID vaccines in the same, not exactly the same, but in a similar way.
I appreciate that. And Dr. Califf, how does new scientific information from the study of an infectious disease allow FDA to better determine the safety and efficacy of new vaccines or treatments and evaluate if they are ready to be publicly deployed?
Now here I would stress two types of information. One is biological information coming from laboratories, both those that are funded at NIH and what industry is doing and the community of universities around the world. It's the only way to keep up and to know that the vaccine that you're proposing actually has activity against a specific variant. But the second kind that Dr. Walensky has talked about over and over, in the end, the true test of anything the FDA does is what the effect is in the intact human being. We need an ethical deal. You think about yourself or me. When I get sick, I hope that a lot of other people have volunteered their data so that I will get the right treatment because my doctor will know. We've had some discussion about this. Doctors are smart. I'm one. I think I'm pretty smart. But I'm a lot smarter if I have the evidence. So I call a doctor alone eminence-based medicine. A doctor armed with evidence is evidence-based medicine. It's much better. It will only work if we volunteer our data and participate in research.
I hear the evidence-based argument. Dr. Walensky, I know that reopening schools safely was a priority for you and the Biden administration from day one. So can you explain CDC's approach to using public health data to provide schools the guidance they need for teachers, school staff, and children to return to in-person learning?
Absolutely. As we create our guidance, and as you know, this was a priority for me. 46% of schools initially opened, 63% within months, and then by the fall, it was up to 95% in terms of getting schools back open. So we used a layered mitigation strategy. Remember, at the time, there were no vaccines for children. We were vaccinating adults, but we didn't have vaccines for children. So what were the strategies that we could use? Vaccination was one of them. Masking was another. Distance at the time when we had high levels of community transmission was yet another. And then we saw these ecological studies, cohort studies in states that said when these jurisdictions had masks on and these jurisdictions didn't, there was more infection in the schools. When the masks were off, that schools had to close because masks were off, and it was based on those kinds of studies, whether it be in Georgia or Wisconsin or Arizona or across the country, where we were able to amend our guidance in real time as those variants emerged, as Dr. Califf noted.
Thank you very much. And with that, I yield back. Mr. Chair, I did have some questions for Dr. Tabak, but we'll get that to you in writing. Thank you.
Thank the gentleman. Gentleman yields back. Now recognize